Association of Addictions Professionals. We're the state's largest association solely dedicated towards substance use disorder providers and prevention providers. I appear to you today on behalf of that organization. We oppose the marijuana legalization in Kansas. Social costs of other taxed substances like alcohol and tobacco are greater than the tax generated. And I'm going to, in terms of my testimony, kind of try and hit some high points, be quick, and not be duplicative. The National Association of State and Alcohol and Drug Abuse Directors produced a document which I can provide as well. Just some highlights here. In 2013, 845 people received treatment for marijuana use. It's the second most common substance after alcohol. Marijuana is the most commonly used illicit drug among adolescents, 12 to 17. I think you've heard that here. I think you've heard about a lot of the public health impacts, lower educational achievement, use of other illicit drugs, increased risk of suicide, driving under the influence after alcohol. Marijuana is the most commonly discovered substance in the blood of impaired drivers, fatally injured drivers, and crash victims. Our treatment system collects data about the drugs that people use as they go into treatment. And so from 2012, that data shows that for folks under 21 years of age, marijuana is by far the leading drug that people use that go into services. It's a close second for those over 21 as well. In the Kansas Communities That Care, or the CTC survey data, it indicates that the perceived risk of using marijuana has gone down in recent years. The CTC student survey is taken by approximately 100,000 students annually here in Kansas. It asks teens about their behaviors and attitudes regarding alcohol, tobacco, and other drugs. According to last year's survey, just a few points from that survey, Kansas students increasingly don't think marijuana is harmful. About almost 26% of those students, grades 6 to 12, think that there's no risk of risk for regular use. That's increased for all age groups since 2010, ranging from about 4% to an 8.5% increase. More Kansas youth smoke marijuana than tobacco. Just as an aside note, that data that I was just quoting, CAP, our association, is also advocating for an exception to the Student Data Privacy Act that was recently passed. That's in order to kind of keep the integrity of the CTC data, which, like folks have talked about, our system uses to kind of make evidence-based decisions about how we help students deal with alcohol, tobacco, and other substance use, along with other risky behavior. CAP's not made up of researchers or doctors, but rather is substance use disorder treatment and prevention professionals. Therefore, we're not qualified to speak about the medical impact of legalizing marijuana for medical purposes. However, what we see is the substantial social impacts of marijuana use in those that we work with in our programs, and that's really the focus of this testimony. Increased access to marijuana will lead to increased use, which leads to an increased perception that marijuana use isn't harmful. This will lead to kind of an increased pressure on our treatment and prevention system. It appears that perhaps the crux of the issue is kind of like what folks have said, weighing the possible benefits with the pretty high social costs involved. We really seek to just ensure that you're aware of those social costs that marijuana already exacts in our state and could produce at a higher rate if legalized. We at CAP are here to help with any questions as they relate to alcohol and drugs in our state, and happy to answer questions.
Thank you, Tim. At committee, we also had written testimony from the Kansas State Board of Pharmacy, the KBI, Kansas Family Partnership, the Kansas Trauma Program, Kansas Medical Society, and the Kansas Society by Physicians and Surgeons. We have 4 minutes for questions. Senator Turner.
Thank you, Madam Chairwoman. This question's for Ed. I appreciate your testimony, and you represent a group of people that I know are very important to each of us up here. I don't know how your organizations work exactly, but is there disagreement? Has there been a vote taken of an executive board or something? I'm not sure how it works, but I'm curious if there is disagreement or if this is fairly universal within.
I think like any organization, when you get into these types of issues, and whether it's marijuana or gun issues or many others, you never have 100%.
Sure.
We have legislative committees that have done a very good job of representing the overall viewpoints of our association, and so that's our first line of referring subject matter to you to see what our position will be. And if we don't have a clear majority that is supporting or opposing some matter, then oftentimes what we will do is come in with neutral testimony and say, you know, we're not here about the basic principle of what you're trying to decide, but if you do this, this is what works for us, this is what causes us problems. So it helps you craft any legislation so it's workable for us, because after legislation is passed, many times we're the ones that have to go out and make it work. And so we want to work with you and try to get the language to where it works and delivers what you want us to do.
Right. So you would characterize your opposition as a clear majority of your members?
When we posed this, yes, it was a nearly unanimous, I would say, to oppose the bill that's on the table, which is not the subject of this.
Sure. Thank you, Madam Chair.
Senator Hale.
Thank you, Madam Chair. Thank you again, Chief Plum. I want to concur with Senator Turner. I thought this was a very well presented, and I appreciate your analysis. Known you a long time, and certainly respect as you brought this today. I do want to share with the committee and with you that there is an organization about 100,000 strong called the Law Enforcement Against Prohibition, and they're comprised of police and judges, and prosecutors and supporters from around the country who, like Chief Klump, have a history in law enforcement, but they don't believe that prohibition is the way to go. I commend to you and to them their website, LEAP.org, L-E-A-P, Law Enforcement Against Prohibition. Chief, how much of your time or the resources of your association, which you say is spent with the apprehension and the prosecution of those who have a minor amount of marijuana in our state in possession, those resources? I know your testimony was that it was difficult sometimes to segregate out between that and alcohol.
And that's the kind of data we just don't have. I couldn't put a number on it. But I don't think it's a very large percentage of our time that we deal with people with only marijuana. Now, sometimes we deal with people with marijuana who we've arrested for some criminal act other than the marijuana. And we find it in the process of, making the arrest and processing them through the system. Sometimes it's other drugs, but they also have marijuana. But I don't think we spend a great deal of time on just marijuana cases.
Our concern being is, as we look at medical implications of those that are using marijuana to alleviate some malady that they have or some pain that they have, that they have a small amount of marijuana in their possession. We certainly are concerned about their apprehension, arrest. As you know, other states in D.C. have moved to so-called decriminalize. That's not what this hearing is today, but it was incident to your testimony. Thank you, sir. And Ms. Brown, very quickly, social costs, were it not, if marijuana were legal to be prescribed, would the social costs that you outlined here be as significant? I mean, driving under the influence notwithstanding, other than that, are there any other real social costs because anxiety, depression, suicide thoughts, and schizophrenia? As the addiction professionals, is there an addiction that a social cost would be accelerated by if marijuana were legal? Is that not part of the problem?
I think the one piece that I spoke to that relates to that really is around the increased access leading to increased use, and then potentially the need for folks having increased access to treatment resources. Our treatment resources are already not funded enough in our state, so that's an impact.
Do you do a lot of treatment for marijuana?
I'm going to have to close down the meeting because we have to be on the floor a minute ago. But thank you everyone for coming, committee members. I hope you receive